not being able to feel your legs. You try to move them, but nothing happens. That terrifying reality is something thousands of people face every single year due to spinal cord injuries. Hi everyone, today I would like to talk to you about something that doesn't often make the headlines, but changes lives in an instant. Spinal cord injuries, or SCIs. After researching the topic, using sources like the Mayo Clinic, the National Spinal Cord Injury Statistical Center, and the Reed Foundation, I've learned just how complex and life-changing these injuries can be. By the end of this speech, you'll have a better understanding of what spinal cord injuries are, how they impact people, and what treatment and technologies are offering hope for the future. What are spinal cord injuries? The spinal cord is the body's communication highway, carrying messages from the brain to the rest of the body. According to Mayo Clinic, a spinal cord injury occurs when there is damage to the spinal cord that results in loss of function, such as mobility or sensation. These injuries have two different causes, which are traumatic or non-traumatic. Examples of traumatic injuries are car accidents, sports injuries, or falls. Examples of non-traumatic is infections, tumors, or diseases. Types of spinal cord injuries. There are two types of spinal cord injuries. The two types are complete and incomplete. Complete is where all feeling and motor functions are lost below the injury. And incomplete is where there is still some degree of function. Then there is paraplegic versus quadriplegic. Paraplegic is a loss of movement in the lower body, and quadriplegic is affecting all four limbs. Effects of spinal cord injuries. The physical effects include loss of movement and sensation, which makes everyday activities challenging for people with spinal cord injuries. Bladder, bowel, and respiratory challenges are all things that are also a struggle for people with spinal cord injuries. Risk of secondary complications like pressure sores and infections are prone to happen in these situations. Psychological and emotional impact. Depression, anxiety, and PTSD are common for people with spinal cord injuries. Coping with the sudden life changes can have a huge impact on a person's mental health. The importance of mental health support can be just as valuable and important as the physical needs for a person with spinal cord injuries. Social impact. Challenges in employment and relationships are two struggles people with spinal cord injuries face on a daily basis, along with accessibility and independence issues. Treatment and advances. Emergency care and rehabilitation include stabilization, surgery, and early intervention are all things that give people with spinal cord injury a chance of movement and sensation. Physical and occupational therapy can help the body function and motor skills get stronger and allow the patient to be more independent. To wrap up, we've talked about spinal cord injuries, what spinal cord injuries are, their deep and lasting effects, and the exciting innovations giving people hope for recovery and independence. A spinal cord injury can change a life in a moment, but with access to the right treatment, support system, and ongoing research, many individuals go on to live full, purpose-driven lives. And here's where we come in. By supporting spinal cord injury research, advocating for accessibility, and learning more about the people behind these stories, we can help build a more inclusive and acceptable world.